couple of suggestions coming in from the chat. Egypt, that's awesome. I'd love to see Egypt. What else? Everglades. Oh, that's neat. Okay. All right, so let me get back to sharing the correct screen here. This. So now that we're live, you know, we pretty much know each other. Just a quick reminder about community agreements. Our expectations for you all is just timeliness. So far so good. I do want to encourage everyone to give honest and constructive discussion feedback. It is necessary for us to get results and really for us to achieve any kind of improvement. So be prepared to contribute to achieving all of our goals. The more you put in, the more you get out. Share your perspectives and value everyone's contributions, and stay open to new ways of doing things and really out of the box thinking, which is what we're going to explore a little bit more today. As an overview for today's session, we're going to be looking at aim statements and really look at purpose-driven change or purpose-driven quality improvement work. So we'll explore why it's important to have an aim statement, how you'll know a change is an improvement, the importance of measurement, how to use the model for improvement that you probably remember from the first session, and to apply that to your QI project, and then also to learn how to facilitate the creation of a priority matrix. So in completing today's session, you'll have additional tools that will help you complete the P1, which is why change is needed, from the A3 report that's going to be due at the end of the year. So you're already on a great track. So I do want to kind of review a little bit of the concepts from, or a few of the concepts from the last session. So the first question I have for everybody is, which of the following are important ways that data help us understand something? A, the efficacy of care. B, the efficiency of a system. C, the degree of improvements over time. Or D, all of the above.
Jessica, Suzanne, and Charlene, I'll say D.
D. All right. Do I have some consensus from the group?
Yes. All
okay.
of the above.
Okay, great. Yeah, the answer is D, all of the above. So data can help us do all of those things and more. So we'll explore some of that today. So my next question is, name one type of chart and how you might use it. So you've all had a little bit of practice so far on charts. So if you can just kind of briefly, if you had to summarize it to someone who was, let's say, 5 years old and explain it to them, what kind of chart would you pick and how might you use it? I don't know if anything's coming through in the chat, but feel free to unmute. I know this one gets us our brain going a little early in the morning.
Charlene says line chart to compare different variables. Then
Okay.
Suzanne and I are going back and forth about talking to a child about it. We were talking about bar charts. What were you saying?
Look at the bars.
The
blocks. Look at the blocks.
And that they represent, you know, different pieces of data and where they're at, I guess, either in a percentage or number or that kind of thing.
Yeah, excellent. So you hit a lot of great points. So it's important to think about variables. So there's 5 different chart types that we reviewed last session. But of course, there are many more types of charts available. And if you had a chance to do some of that work in Excel, you definitely saw that there are a lot of options there. Some of them you will never, ever use, and that's okay. The line chart is most important for connecting observations or data points, usually over time, but that's inferred. So it can really depend on the type of line chart you're looking at and what type of data points you have. A run chart is just another version of a line chart, but it records observations over a much longer period of time, which is why you need a lot of data points for it. Usually at least 15 data points is needed for a run chart for that to be appropriate. A bar chart, like someone mentioned, is comparing performance among categories of data. So you can compare different categories of a single variable, but depending on how you set up the chart, you can also compare multiple variables. And so when I say variables, I'm talking about things like either demographics, age groups, what else have we seen? Viral load, all kinds of variables. And then a pie chart is kind of similar to a bar chart, but it's really just for comparing categories of the same variable. And that's really important because the minute you add on or layer on another variable, it gets very confusing. So when you look at a pie chart for age distribution, and I apologize if that's a little bit small, but it's the same exact example we used in the last session. You would never want to layer age on top of gender in the same pie chart, unless you're talking about the age distribution across all female clients, for example, or all male clients, for example, then it would be okay. But you wouldn't want to layer age plus different types of gender because it wouldn't work in that pie chart. And then a combined chart is an excellent use of combining different categories of a single variable to another indicator or another type of variable. So the example that we used last session was to compare the viral load suppression across age groups and using that same distribution. So hopefully that sounds a little familiar to you. Hopefully you feel a little bit more comfortable using the charts after the homework assignment. So our third question, review true or false. Quantitative data are numeric values that answer how many, how much, or how often.
Suzanne, Charlene, Kate, and I all say true.
That's right. True is the answer. And so qualitative data, just as a reminder, is the opposite of that. It's going to be looking at descriptive factors. It's going to be looking at things that can still be measured, but not necessarily numeric value. So maybe more things that are descriptors, which Mika talked a lot about in the last session, so I won't rehash a lot of it. For question 4, which is the term for a method of understanding how the system is performing without having to look at 100% of your population? And this was when we talked about how to measure things or how to create measures. What was one way that we could look at, still get a sense of how we were performing without having to look at the entire caseload or 100% of the population? Any ideas?
Yes, Yates said sampling.
Awesome. Yes, data sampling. That's exactly right. So when you think about like, how do you make sure you figure out what it is that you need or pull the information you need without having to look at everyone? The example we gave was if you wanted to monitor the completion of needs assessments at your agency, but you had 1,000 clients, which is not unheard of in some of our agencies, you would want to definitely sample that, especially if you were looking to do that monthly. You might pick 3% of that 1,000 clients. Or when I say 1,000 clients, we're probably referring to active clients, of course, not clients who have been closed out or are no longer with the agency. So 30 clients out of 1,000 each month, it's definitely doable, especially if you're just looking at that one piece of documentation each month, needs assessments. But it's very likely we're not looking at just that, right? We may be considering other kinds of variables. So that 30 may even whittle down to 15 or 10, depending on the agency and how much you're monitoring each month. So great job. Before we move into the content for today, I did want to check in with everyone about the homework assignment. Thank you so much for participating. I got full participation from everyone who's here today. So let me know, how did it go? What did you like about it? What did you dislike about it? And then if you did have trouble, what are some of the things that you struggled with?
This is Jessica. You and Mika's training in the back end was very, very helpful. I realized after I did some, like maybe my title wasn't as informative as it could have been. I don't think we had any other issues though. Yeah,
Great.
once you guys showed us how to do it, we were pretty comfortable with it.
Great. And let me just say that I I don't know. I guess we just didn't think about it, or we didn't think we'd have enough time in the last session to go over how to actually create a chart in Excel. But like as you heard from Jessica, we did have an offline discussion to kind of do a quick tutorial. I'd love to be able to record something like that for general use if that's something that you all feel would be important for you. And maybe not for you specifically, but for someone at your agency who has never really used Excel before, or maybe they did many years ago in school and just don't remember. I know that was me for a lot of things. So I would be happy to do something like that for everybody that can hopefully, everybody could find some benefit out of that.
That would be
What else?
wonderful. Then I
Yeah.
won't have to do it for everybody.
Right.
Yes. And that would be the idea. We'd want to record it so that it's available just like these QM Learning Lab recordings. We want to make it available and kind of centralize it in one resource hub at some point. All right, what else?
An issue I had with the line chart was I realized after I did it that there wasn't a wide enough range. So looking at it, it's almost deceptive because I was measuring viral load suppression across a year, but the highest was 92 and the lowest was 88, which is really not that much of a difference.
Mhm.
But because the chart only went from 86 to 93, it looks like it was a huge dip in viral load suppression, which is somewhat misleading because it's,
Mhm.
like I said, 92, 88. I mean, those are still really good numbers. So a line chart was not the best way to do that, or I should have been able to spread the numbers out more, if that makes sense.
Yeah, absolutely. And we'll definitely explore a little bit of that throughout the next part, the next segment that we're going to work on, because that is an important piece, is to consider how you format, how you might change the range of your axis. It definitely matters because it can make a graph look like it's going, especially a line graph, it could look like huge change, but really when you look at the axis, there's really not much difference there. So great. I'm glad that you brought that up. So we're actually going to dig into everybody's homework assignment a little today, and I don't want to put everyone, I don't want to single anyone out or, make anyone feel uncomfortable. This is all for learning. So just a reminder that this is our space for learning, for sharing the knowledge along the way. You already know that charts and graphs can help you examine your data and communicate the results of your improvement efforts. So we're going to do a quick little exercise. And on the next set of slides, we're going to be looking at several charts. They are from the homework assignments. I made no changes to any of them. So each slide will display a single chart. So we'll be looking one at a time. For each slide, we're going to spend 5 to 7 seconds analyzing the chart. And the reason why I say 5 to 7 seconds is because if you remember from the last session, that's about the average time that people spend analyzing a chart and trying to get a sense of what the message is. So we don't want to spend too much time looking at it before we give our impression. So after that 5 to 7 seconds, I'm going to give everyone, I'm going to kind of count it off, maybe not so much out loud, but in my head. And then I want to hear your first impression, right? And comment what comes to mind. Even if it's your own chart, that's okay. You don't have to say it's your chart, but just comment what comes to mind. Comment, what you like about it, what you might do differently. All right, so if we're ready, we're going to go ahead and get started with the first one. Spend that 5 to 7 seconds really looking at the chart, analyzing it. Okay, so what kind of chart is this?
It is a bar chart, but my initial, and I guess it's the way that it's displayed. And of course, I don't have on my glasses, so I can't really even see what the legends are, right? I can't read it. So
Sure, and I can help with that. I mean, I have a big screen in front of me, but the title says male viral suppression. And then the legend at the bottom for the different bars includes Black African American males, Hispanic males is the orange, and then the gray is white males.
Ah, okay.
All right, so we know it's a bar chart. It is a vertical bar chart, by the way, because remember there's vertical and horizontal. So in this case, we're looking at a vertical one. What's the variable that we're looking at? Usually a good indicator is probably the title at the top. So in this case, we're looking at viral suppression of male clients. And so what are the categories measured by? We've already kind of assumed from the legend that it's based on race and ethnicity, since Black African American males, Hispanic males, and white males represents race and ethnic categories. So what notes do you have? What's great about it?
I think it's easy to read.
In comparison.
In the comparisons, yeah.
Yeah, absolutely. It's very neat. It's easy on the eyes. Having different colors for the bars is always, always helpful because you can see distinction between the lines and you know right away that you're comparing categories across each of those time periods. And if you can't see that, the axis at the bottom essentially has each quarter. So starting in year 2020, fourth quarter, and ending in 2022, the second quarter. So each of those sections with 3 bars in each is 1 quarter for each of those race and ethnic categories. So like I said, it's easy to see the changes from 1 quarter to the next. If you can't see from the screen, the axis starts at 0 and it goes to 100. So it clearly uses the 0 baseline. And that was something that we talked about was important for a bar chart. You always want to start at 0. There are instances where you may not have 0, but like Charlene mentioned, that can really skew how the data looks. It could make it look like there's a much bigger change than what you're seeing. One thing that's interesting is that it's really easy to see change from 1 quarter to the very next. But what do you think about seeing it over, like across the whole period? Like if I said to you, how did Hispanic males do from the fourth quarter of 2020 to that second quarter of 2022? Is it still easy to see?
It's, yeah, their viral suppression percentage increased in comparison to Black males and white males.
Mm-hmm. So one thing I'll point out is that unless you're, Spider-Man and you can isolate one color of the graph without really focusing too much on the other colors, it's a little harder to kind of assess that change over a much longer period of time. When you're looking from quarter to quarter and small chunk to small chunk, it's much easier, right? Like we can see that from the fourth quarter of 2020, which is this first section here, to the first quarter, the next section, we did see an increase for Hispanic males, right? But that gets a little bit harder once the numbers are closer together. So in the middle here, from 2021 third quarter to 2021 fourth quarter, there's very little change there, right? And unless you have the data labels up, it's much harder to assess whether it's actually going up or it's still the same. So just something to note. One thing I would definitely consider with this graph or chart is to make the font bigger. And that's something that I want to stress throughout the whole time we are talking, because I know that just from our experience working with the Planning Council, sharing information like this regularly, we always, always, always get that feedback to make the font bigger, make it very, very legible. And don't be afraid, it'll look very, very big on your screen. It'll look kind of obnoxious, but it always helps, especially if you're displaying this for a group or a large room where they may not be able to see as well in the back, or they just may have trouble with their vision. I know for me, I always immediately make the font bigger whenever I'm looking at something, and that's like the first thing I do as soon as I make a chart. Before I ever copy it into anything, I make the font bigger, because now I know that presentation is the first thing. So if we can't see the title, we can't see the legend, we can't see the axis or the range, what good is the chart, right? Not to say it's not good, but we'll have to struggle a little bit to find out what the message is. I would also consider adding a reference to a target or a goal. One way that you can do this is to make this a combined chart, maybe adding a line somewhere. But it's flexible. There's different ways to do it. And you don't have to add the target or goal, but it does help, right? Because then we can see not only is there change over time for certain race and ethnic groups, but are they meeting a certain goal that we've outlined already? One thing I would also know is to probably consider using shorter blocks of time. So comparing each quarter in a single year can work. So, but when you span it across multiple years, then it becomes maybe a little bit more difficult. But one way you can actually find a solution to that is to use a line chart instead of the bar chart. So once you know you're kind of crossing over a much greater period of time, you're still looking at quarters, right? But you're looking at quarters across the span of multiple years. Line chart might be better for this. It doesn't have to be, right? But it can look a little bit more appealing to the eye. So I don't want to put anybody on the spot. If the group that gave this chart wants to say anything else about it, like what did they, struggle with, or what's something they would do differently, or what do they like about it as well, feel free to unmute. I won't identify though if we want to move on to the next slide.
No, that's us. It's Jessica and Suzanne. So one of the things is that you can't tell what kind of, how large of a group, so maybe having some numbers for either the overall male population or the subpopulations that are involved in the measures.
Yeah,
And
absolutely.
Then, yeah. Well, so we were trying to show during the pandemic, our Black African American males like super dropped for viral suppression. And so we've been consistently following that because it was a very strange drop.
Mm-hmm.
So I was trying to capture it from beginning, but then it was too much. So then I shortened it down to these quarters, and like you said, it's still kind of a little much there.
You can see it though. The blue bar is the one that represents Black African American males, and you see it dipping, right? But because we have the zero baseline, it doesn't look like there's very much change, but then you start to see it pick up as well. There's actually a pretty neat trick that I could show you some other time too, where once you have it set up this way and you realize, you know what, I don't want to group the race and ethnic categories across the quarters, I want to flip it, right? So then you could look at just the African American males across that time span, then just the Hispanic males, and then just white males. And I've used that before. But again, there's different ways that you can be flexible with it. I think ultimately a line chart would still be best because you're comparing multiple race and ethnic groups across the same period of time. So it makes sense to just see it as a line versus like long bars.
Another thing, like on the chart, somebody else saying something. On the chart, I don't know if we're just looking at charts, but like Jessica was saying, like the numbers of the individuals, because it could be like two. I mean, it's not going to be two, but like two Hispanic males could be, 100%. So, it's the numbers of individuals as well. But also, like if you had a drop in African American males with viral suppression, are those African American males still taking medication, ARVs, with viral that? So is this males who are the viral suppression in care, or is it just on medication, or is it those that are in care not on medication? So
Yeah, that's a great point. So obviously the charts can generate even more questions. So that's why you really have to consider your audience. Are you presenting this to people who are already familiar with what we're looking at, with who the caseload is, with how maybe the size of that caseload? When it says male viral suppression, is it obvious to the audience that it's viral suppression of active male clients, or it's not? I think that's kind of what Brian's kind of describing in that example. So very important to consider the audience, but great job. This was a really great example to look at. All right, so we'll go ahead and move forward to our next chart. So pretty obvious, but just in case, what kind of chart is this? Pie, yes, pie chart, circle chart, whatever you want to call that. It's a pie chart. And then if you can't see the title, it says overdue viral loads. And then the legend down here says it's 4 categories. So it says less than 30 days, that's the blue. 1 to 3 months is the orange. 3 to 6 months is the green. And then greater than 6 months is that yellow slice. So what's the variable here? What are we measuring?
The overdue viral loads?
Yeah. In this case, it may be a little harder to tell because you don't have the data table. So in order to make sure we're not having to go back and reference the table when we look at the chart, we want to make sure it's very clear what it is that we're looking at. So we're looking at the number of clients with an overdue viral load. And so the categories that we're measuring that by is time elapse. So number of days or months since the last viral load, or since the viral load became overdue. And I want to make sure I'm interpreting that correctly. So feel free to chime in if you have a correction for me on that. That was just what I could kind of gather from the data table and then putting it into the slide.
Yeah, we just had some labeling issues we thought we'd address while we were here today.
Yeah, absolutely. So some notes. It's effective, I think, and it's visually appealing, right? We use different colors. It's very clear to see the distinct slices. It's also very clear that we're using an appropriate number of pie slices. We don't have too many. We don't have too few. So we can really get a sense of the proportion that we're looking at. One thing someone kind of already mentioned, I would consider adding data labels. And so when I say data labels, it's saying, how much of this is green, right? Like, is it a percentage? Is it a number? In this case, it was a number. You can kind of, assume if you're any good at math or any good at whatever that I guess subject matter is, that this orange represents very close to 50%, right? So it's kind of easy to see that the blue is probably somewhere around 20%. This green is probably another 20% or so. And I'm just kind of off the top of my head, I don't really remember the data table, but the data table actually wasn't in percentage. It was in the number of clients, which is why it would be really important to add the data labels if you want to communicate that message. So we can already get a sense of what each slice is representing as part of the whole. But in order to communicate what the actual numbers are, so people get a sense of how many clients are we talking about altogether, the data labels are important. It also would eliminate the need to include the data table that I referenced earlier, so the table where the actual data was, if you add the data labels. You don't have to go back and look at it. I would also, again, consider making the font bigger. Always going to be helpful to somebody in the room. So anything else we'd like to note or comment on this chart?
I think whoever did it, it's amazing.
Yeah, it's really nice. It's really nice. And I did see the lack of data labels throughout. So I think it's a trend of just not knowing where to add it, because sometimes Excel will not automatically assume that you needed the data labels, which is kind of an annoying feature. I'd rather have to get rid of things rather than have to add them in. But that's technology.
Hi, this is Jessica. I think it looks good. I think my question that generates is what is considered overdue. So maybe adding a definition of, in parentheses or something like that.
Yeah, absolutely. And so that's an important note to consider for your audience. Does the audience already know what overdue means? Does that mean that your clients are supposed to be getting their viral loads done at least every 6 months and they're already past that and we're just measuring the number of days after that 6-month period? Or is it maybe a shorter frequency that they're supposed to be getting their viral loads done? So great question. All right, we're going to go ahead and move into our next chart. So at the top, it says percentage of bridge patients who are virally suppressed, and then year to date. And then on the vertical axis, we have bars. So that should be a clue. May, April, March, February, and January. And then at the bottom here, we have percentages that range from 0 to 90%. So we're looking at a bar chart. This is an example of a horizontal one. So what's the variable here?
Viral suppression of bridge patients.
Yeah, absolutely. The viral suppression of bridge patients. I'm not sure what bridge is, but that's okay. We don't need to know. The variable is viral load suppression of bridge patients. What are the categories we're measuring by?
Months.
Months, exactly. And because it's year to date, we don't have a full picture of the whole year, but that's okay because we're assuming that more months will be added as time goes on. So some notes I have. It's clean. It's not busy. It's the title, very clearly describes what it is that we're looking at, but the bars really help because we can clearly see the difference in performance, right, across each of those months. It uses the zero baseline. So we start the axis at 0 and we end at 90%. So that's great. There's only one variable, which makes this very easy, very straightforward, and it just tells the data. One thing I would consider, of course, again, making the font bigger, adding a reference to a target or a goal. You don't have to, but if it's something you already have, you might want to consider adding it. And you also assume that additional data points will be added in the future. If we're looking at months, we're going to be adding more months. But eventually, this might make the chart look a little cluttered, right? Because if we have 12 months in a year and that's our measurement year, 12 bar charts here, it's going to be a little bit harder to see no matter how big you make the font. So this would actually be a perfect example of eventually you might want to convert this to a line chart. What other notes, comments, questions does this generate?
Hi, this is Jessica. When I'm looking at it looks good. When I'm looking at it, I'm thinking, were more patients added on, which maybe led to the drop in March because they're new patients and they haven't gotten their labs done or something. So I guess maybe, I don't know, what would you do? Number of patients or something like that?
Yeah, so consider the audience. Does your audience already know how many patients are enrolled in the bridge program? Is it a consistent number or is it constantly changing from month to month? And is that important to share with the group that would be looking at this chart? One thing that also sparks for me is the fact that the chart up here, we kind of tend to look at things vertically top down and then horizontally left to right because of how we read in the Western world, which is fine. But when I looked at the data table, which was really interesting, the data table was broken out by January, February, March, April, and May. But as soon as it got put into the chart, it actually reordered everything, I think. And I'm not really sure why Excel does that. I've had it happen before and it's incredibly frustrating. But I don't think we meant to start with May and go backwards, right? So I think that's important to consider too. You might need to add a technical note or share a disclaimer or maybe somehow rework the format so that it shows you starting in January at the top and then ending with May. Unless you prefer it to start with May, that's totally okay. But that's just something to consider too.
Yeah, this is it was my chart. So that was problematic because I did have the data table from January, starting at January and going down. And then when I did the chart, this is how it presented it. And I didn't know how to change that. So
yeah. No, I definitely feel that. I've had that happen many, many times, and it is really frustrating. So it's important to kind of spend some time and play around with settings that you see. So that's why doing that little tutorial is going to be really helpful for everybody to kind of go back and then look at these same charts that you worked on, and then you'll be able to tweak it and modify it the way you prefer. So great point. All right, next. Go ahead.
What do you suggest when you have a program that has a fluctuating number of clients? When you're doing a chart, percentage or numbers? Because I don't know. What do you do? What do you do, Jessica, when you have that? Do you do charts that I guess it would depend on what you're measuring, right? Because if you end up with a lower amount of clients in a certain month, that could show the percentage as a different amount and make it look less successful, but you could be more successful if you look at it as numbers, correct?
Yes. And I don't want to step on Jessica's response.
So is there a suggestion if you have a fluctuating number of clients in a program that you would measure preference? There's a measure preference, or is that something that you would definitely want to note in your charting, that you would want to compare the number and the percentage in that when you?
Yeah, it really depends. One thing that's been helpful for us is, when I say us, I mean like our Ryan White program. And when we report out to Planning Council, for example, is when you have a chart like this, you're obviously wanting to measure viral suppression as a percentage, but knowing the number of clients really does matter, because let's say that May has the highest percent, performance, or the highest percentage performance wise, and that's great. But what if that meant that there were many clients who disenrolled from the program in that month, and that's maybe what's skewing it, or the opposite tends to
Exactly.
happen. The minute
Yeah.
you lose clients, sometimes that viral suppression drops significantly. So one kind of workaround we've developed before is to still use the percentage as part of the axis here. But what you could also do is add, and usually it involves having a second column with a different little title to show maybe the denominator or to show the total number of clients. And when you generate the chart based off of that table, including the percentage and the number of clients, it can tend to add another like indicator, or even sometimes there'll be a number that shows up within the chart that shows the number of clients. So you still get the percentage, but you also get the number of clients in
Okay.
each bar.
Right. Okay.
Outside of that, because I know Excel can be complicated and difficult to learn, you could always just add another little table here that shows the
Exactly.
number of clients for each of those months. And because
Right.
you don't have very many months so far, it wouldn't look cluttered. It wouldn't look too bad. That might be something you'd want to consider changing at some point, though, or displaying a little differently. Maybe it's a vertical table, and then the line chart, for instance. All right, so we'll move into our last one, and I apologize, I'm not going to be able to get through all of them, but y'all did a really great job, and there were a lot of really great points to make about every single one. So we are looking at, like the title says, viral load suppression, right? In the year 2021, so it can be assumed that we're not looking at months in any other year. This is obviously a line chart, and the categories are measured across months in the calendar year of 2021. So that's important to note. So notes that I have, it's very clean. It's not busy. We can clearly see the change in performance, and we're not looking across too big of a time span too. So we can really clearly measure, that measurement period and how did we do over that time. We can also clearly see where there might be some trends. So what's happening during periods of improvement. So we see some periods of improvement here where the line goes up, where the line goes up, where the line goes up. We may also be able to see trends in declines or decreasing performance. So here, here, and then here, right? This is definitely an area we would want to take a closer look at. But we also have some periods of plateau or, no change in performance. So that could also be something that you might want to explore. And when it becomes a trend is kind of subjective. But this is why using the difference between a line and a run chart is important, because a run chart looks at across a larger span of time, so you can very clearly see where there's a trend. As a general rule of thumb, something is a trend when you maybe see that across 4 or 5 data points, right? And so here we're looking at May, June, July, and August, that plateau area. So that could be a trend, right? And we might want to explore what was going on in that time period. Why did we not see any change? And it could be many, many reasons. But we'd also definitely want to consider exploring this change here, right? This trend, because this is 1, 2, 3, another 4 data points. So almost, it's not 100% a trend, right? Because we want around 5 data points to consider it a trend. And those data points could be months, they could be days, they could be years, depending on how you're measuring the axis. But very clearly, we see that something is not right, and we probably want to take a closer look at it to see if we can kind of pick things back up the other way, or at least have no change for a period until we figure out what it is that's going to result in improvement. One thing I would consider here, making the font bigger, of course, the additional data points, or I'm sorry, that additional data points will be added in the future. So in this case, comparing a few periods of data, if you have it, right? Not if you don't have it, but if you already know you have not just 2021 viral load suppression, but you already have 2020, you already have 2019, you can actually create a run chart out of that because you're going to have enough data points. If you recall from the last session, we said that you need to have about at least 15 data points in order to have a pretty good run chart, but this would be a great opportunity for that. If you don't have the data, and that's okay because we have to start somewhere. So anything else you want to comment, you want to maybe consider how you would have done differently, things that you really like about it. This was also a really great example for Line.
Yeah, I like that they gave us, expanded the range so it doesn't look all clumped together. Yeah, I think they did a good job.
Yeah, definitely. If we had, oh, just a note, if we had started at a 0 baseline, that would have resulted in what Charlene was talking about earlier, where you don't really see the line change very much. It looks pretty flat. And then if you layer multiple lines, like let's say you're looking at viral load suppression of males versus females versus, or even, across race and ethnicity or age groups, then having a lot of little lines that are pretty flat makes it a little less meaningful. So in this case, we changed the range of the axis so that it starts at 86 and it ends at 93. And now we can clearly see the change that's going on. And in this case, it's okay to do that because you definitely want to be able to look from month to month. How big is that change? And we're seeing trends, right? So that's something that we want to explore. Even though the percentage point is from 90 to 91%, that's still improvement, especially if we're talking about a month. It's not very long. If we're talking about across a span of a year, we started at 92% in January and we ended at 88%. So even though that's not that many percentage points, it's going in the wrong direction, right? We want to make sure that we're resulting in improvement. Anything else? Okay. Well, I want to congratulate everybody. That was a really great job. I want everyone to kind of just take a moment to reflect. You don't have to respond out loud, but just consider how successful were you in analyzing the data, right? We spent about 5 to 7 seconds on each slide, looking at the data, and then it even generated more questions, right? And that's a good thing. You can also consider how do you plan, or whether you plan to use chart tools to present data in the future if you're not already, because that is a really useful tool, right? And it can help kind of refresh the way people look at things and kind of give people some new insight, and it helps generate more questions than being able to just look at a data table. It's a little harder to generate some of those questions sometimes when you don't have a visual. You can also consider, are there any charts you struggle with more than others? Those are the charts I definitely encourage you all to practice with. The ones that you struggle with, whether that's adding data labels, which is a pretty easy fix no matter which chart you're looking at. But in terms of how you present it, how it looks over time, what it is that you're comparing, is it too many variables? Excel actually has a really nice feature where as long as you select the data table and you click recommended charts, it's pretty good at generating a chart that's probably going to be the one that you were looking for in the first place. It may not always be the case. You can always change it, but you can use the same chart type, select it, and then go to change chart type. And if you don't know what I'm talking about, that's fine. I'll come out with a little tutorial for everybody. But you can change it really, really simply using the tools that are already in Excel. One thing to also note is how often were you able to identify a problem? Could you see it right away, or did it take a little bit of time to kind of look at it and say, there's something here I'd want to look at further, right? It doesn't mean there's anything wrong with the chart, but there may be an area of improvement. So that's going to be really important, and kind of keep that throughout your mind throughout the rest of today's session, because we're going to be talking about developing AIM statements. So we're going to use a case study to introduce this and to kind of work along through some examples that we'll look at today. So you can feel free to kind of read along. I'll read it out loud. We have a Main Street clinic, right? It's not a real clinic. It's a Ryan White HIV/AIDS Part B provider. They serve 500 patients approximately each year. They have a strong viral suppression rate of 90% for the past 2 years. Senior leadership at the clinic is supportive of CQI data work and quality projects, and they do a lot of data analysis. So the quality management committee for this clinic has been going strong for several years, but they're under new leadership, and the quality manager is looking for ways to improve services. We'll continue the case study. So they did a focus group, and patients were asked the things that about the things that keep them from taking their meds and keeping their appointments. And although mental health was not the primary focus of the discussion, many clients gave feedback about not taking their meds and not keeping appointments due to having a lack of social support, family stress, and struggles with disclosure. If that sounds familiar, it very much reflects what happens in our own population, in our own patient load. The quality manager presented the results of the focus group to the clinical quality management committee. The committee decided to further investigate the use of mental health services. So the data manager pulled the data from the previous year, and it looks like the clinic's mental health screening results indicated that only 45% of patients, or I'm sorry, that 45% of patients could have benefited from mental health services, but only 50 patients received that service last year. And remember, we said that there were 500 patients total. So 50 patients out of 200, right? That's not very many. So 45%, there's room for improvement here. So just keep this case study in mind. I'll kind of provide a few refreshers throughout the time too. So we want to consider, again, the model for improvement. This is from the first session. So these are the three steps to help structure your improvement project. So we want to set aims to determine what we're trying to accomplish. That's the first box. The second is to establish measures. And then the third is to select changes. So we're really going to focus on the first box. What are we trying to accomplish today? And we'll move into how we know changes and improvement and what change can we make to lead to that improvement using the exercise of an aim statement. And so step one is, what are we trying to accomplish? The key element to building the aim statement is data. So your data will identify what's needed to improve. It can be quantitative or qualitative. It can also be used to identify clinical or process outcomes. So remember, a clinical outcome is something like viral load or any other kind of lab measure you might be looking at. And then there's process-focused outcomes. So maybe the time it takes to complete an intake. It could also be the time that folks wait in the waiting room before they get seen for their visit. Or there's things like the run-through time, which is, or I think it's called throughput in some settings, where you measure the time that someone walks in and checks in versus the time that they're walking out the door, and trying to improve that measure of time. Your data are setting your path, and your aim statement sets the goal at the end of the path. So think of it like a roadmap. Your data kind of tells you which direction to, or your aim statement tells you which direction to go, and your data are the markers along the way in that path to get you to your goal, or to maybe pivot, right, if we've gone in the wrong direction. So in order to build the aim statement, it's important to use a template. If you've ever heard of SMART goals, this is very, very similar to the kind of template you would use for an aim statement. So in this case, we would use the organization name, seeks to achieve, the number of, the percentage of, increase or decrease, because sometimes a decrease can also be improvement, in improvement areas, and you define those from blank, what to what, right? From what indicator to what indicator, by a certain period of time, right? So you'd want to define the time period. So that's kind of like a pretty confusing to read through and say out loud now that I say it. But the example is that the Friendly Care Clinic seeks to achieve a 10% increase in retention from 82% to 92% by June 30th to meet the EMA-wide goal of 90%. Another example could be the Main Street Clinic, which is from our example, seeks to achieve a 20% decrease of no-show rates, right? So we don't want people to no-show, so we want to decrease that by 20% from 50% to 30%. So 50% is our baseline, 30% is where we want to be by August of 2021. So just kind of keep those examples in mind. We're going to practice throughout. This is the first example of our case study, the first draft of our aim statement. By January 2023, the Main Street Clinic will increase the percentage of patients with a documented need for mental health services who are successfully engaged in mental health treatment from the current 45% to 70%. All right, so tell me what you think. Feel free to take a few seconds to read through it again, kind of sit on it. Now think about, but don't tell me, how you would rewrite that statement. Okay, think about what it already answers, but what it doesn't answer as well. So one thing you can consider is, does it answer by when? Does it have a goal? Is that goal specific? In this case, yes, but it doesn't answer out of how many clients, right? It doesn't answer what successful engagement looks like. It also doesn't define what mental health services are included, right? Mental health is a really broad service that includes a lot of different activities. We know sometimes that can even include substance abuse, outpatient or residential services, depending on the facility. So that might be important to know, especially if your audience does not currently know that information about your organization. So the hypothesis is formed by simply stating, if we do an action or an intervention, then this is the result that will happen, right? It's not really spelled out in the model for improvement, but it helps to drive the improvement idea. So it's how you're going to see if your work is having the effect that you want, and you want to test your idea and compare the result to the test to your hypothesis. So we're going to use our case study again to increase access and adherence to mental health services. If we increase access and adherence to mental health services, we will see improvements in the lessening of mental health symptoms. So read over the statement. Let me know what you think. Do you have any problems with it? Would you improve it?
I think the term, the lessening of mental health symptoms, is vague. It's not specific. So what does that mean, and how are you measuring the lessening of mental health symptoms?
That's a great point, and I fully agree. Lessening, especially when we use the words improvement and lessening, those kind of contradict each other, and using them in the same line just makes it a little confusing, right? But it's also just incredibly vague. How are we measuring access? How are we measuring adherence? How are we measuring the lessening of those mental health symptoms, right? It says nothing about how we expect this change to impact adherence to meds, or how it would impact their retention and care, so keeping their appointments. Anything else?
I agree with that. I was thinking if there was some kind of like as evidenced by statement involved there.
Yeah, absolutely. So you can always include evidence that helps support your hypothesis, and you want to test whether that evidence plays out over a bigger scale of time or a bigger scale of patients. So really great point. All right, so we'll go ahead and move into step 2. How will you know that the model of improvement is working, right? How do you know your change is going to this is where you think about how to measure the effect of the change that you make. And you want to think of it as your due diligence. This brings up the idea of having measures to show if your improvement idea is working. So you want to make a plan of where and how you're going to get your data to measure your improvement. Not just the idea, but also the hypothesis. And so with the hypothesis that we used in our case study, we actually have 2 measures. So we're measuring adherence to mental health services and the lessening of mental health symptoms, whatever that means right now. We're still trying to figure that out, right? We also want to measure the access of mental health services and the lessening of mental health symptoms. So this data can be collected with simple check sheets or tables. So in the case of adherence, you'd probably want to record the patient number, whether that's the URN or some other kind of identifier. You'd also want to note whether the last mental health appointment was kept, and if so, on what date. You'd probably want to know who the provider was, especially if you're working with multiple providers, so you can see if there's a pattern. And then you want to maybe assess something like a well-being score, which is very similar to like a mental health screening that you might already be using at your agency, but there are lots of examples for this out there. When you measure access, you probably also want to be recording the patient number so you can see if there's a change over time for that patient. You'd want to maybe measure the ease of access, and so you'd have to come up with a scale for this, right? And a rubric for how you determine, is it easy to access the service, yes or no? Sometimes that is just a survey, right? A survey that you very quickly, not quickly, but easily and regularly do with the patients that access mental health services. Hey, how did your last appointment go? Was it easy to get to? Was it easy to access, right? think about those kinds of questions. So this might require a separate tool like a survey. It could be verbal, it could be written, but you'd want to make sure that you're capturing that data regularly so that you have it for the check sheet. You'd also want to check for the provider to make sure there aren't any patterns with certain providers, and you'd probably want to use something like that well-being score again. Excuse me. So this data will give you information over time. You should consider these data that you're collecting. Sorry, that's a typo. What charts would you use to report the progress to management? Because that's important, not just to management, but your quality committee or anyone else who needs to know this information. You can also use it to show your patients the benefit of staying engaged. You can also use it to evaluate each mental health provider, especially if they're providers that contract with your agency directly, or to assess whether they're really a good fit for your agency. They'll tell you the data will tell you if you're on the right track, and the charts are a really easy way to see whether you're on the right track, especially if we're talking about a line graph, right? We also don't want to overthink it. We don't want to overcomplicate it. You've probably heard the term keep it simple, stupid, or KISS. That's basically what we're going after here. You just want to look at the data and see what it tells you initially, see if there's something else you might need to collect, but don't spend too much time on it, because that analysis paralysis really derails a lot of the work and improvement. So you need to have people that are ready to say, like, all right, we think the data is telling us this. Let's test this hypothesis and see what happens. If the gut instinct when you look at the data is not telling you what you think it needs to, go back and just check, make sure it's correct, right? Make sure the chart is accurate, but don't overcomplicate. So for our case study, we want to consider what measure we're using. So our outcome measure is the % of patients with decreasing mental health symptoms. So that's still kind of vague, right? But maybe we've already determined at our agency what that looks like. So maybe you have a simple screening tool that you use to assess whether a patient is feeling happy, they're feeling fulfilled, if they're eating and sleeping well, if they're able to take their meds and keep their appointments. Those could all be ways to assess their symptoms of mental health. It's not a catch-all, of course. You'd probably want to make sure that you're referring to a mental health provider, which kind of leads us into our process measures. So this is where we could measure the percentage of people that we're referring to mental health services. We could also measure the percentage of people that are presenting with at least one mental health appointment that was kept, right? So that we know that, at least they have a baseline. And then we could also measure the percentage of patients who indicated it's easy to access their mental health appointment. This is where those other survey tools or even just comment cards or something like that really come in handy, is having that regular data to capture the process. Anything else you might suggest for this? Remember, mental health is a very broad activity and broad service, so there's many process measures that could come out of this. So it really just depends on what the priorities are at your agency and what you consider to be an appropriate outcome ultimately. For step 3, what change can we make that will result in improvement? So this is where you develop ideas for change, and there are different ways to do that. So one of the ways you can do that is to conduct a group discussion. You can use change concepts. That's a specific term that refers to an approach to measuring change. You can also consider other alternative methods. So I'll give you some examples for today. One change that we can make that will result in an improvement is to have a group discussion. You can use that to generate ideas, but remember to have people in the room who are very familiar with the problem to be addressed, right? So if you're talking about things like measuring access, right, you may want to consider access could involve getting to the facility for services. It could also involve the time it takes for them to actually get from showing up to the facility to actually being seen. So there are different ways to measure things like that. Obviously, if we're talking about having the right people in the room and we're talking about access, you may want to consider who's providing transportation or maybe responsible for coordinating it. You might also want to consider having the front desk, who's responsible for an intake process or some kind of check-in process, maybe authorization of, insurance information or any of that kind of stuff, they might need to be part of this discussion. You might also want to consider having the obvious, right? The case manager or the mental health provider or anything else in between that process from when the client shows up for their mental health service and sits down with the therapist or a psychiatrist or whomever it is that is providing the service. And then also consider what happens after the fact, right? Because access can also refer to maybe how the next appointment gets set up, right? And so maybe there's a checkout process, and maybe that checkout process is not very well thought out, or it's cumbersome, or it takes too much time, right? The last thing you want to do after you get to see your provider is to sit and wait for someone to come and check you out, right? Especially if you require a follow-up appointment, you want to have that done right away. So that all of that can be considered part of the access. So consider who's in the room or who's at the table, and then who else is maybe missing from that group and that discussion that should be part of the generating ideas. And you'd be surprised, including a lot of those people will generate some ideas you definitely didn't think about before. So if you're kind of feeling like you're in a rut, you're stagnant on the idea, in terms of generating ideas, consider maybe bringing some more people to the table. Didn't mean to spend too much time on that, but we're going to go through a couple of QI tools. One is simple rules for brainstorming. Brainstorming is an excellent, excellent way to generate ideas, right? And it has to be done well. If it's not executed properly, then you're really just going to result in people coming up with ideas, and those ideas either getting shut down, forgotten about, or nothing really comes out of it, right? It's not actionable. So it's first and foremost important to find a skilled facilitator. This involves making sure that there's no judgment that takes place. So this is a perfect example of a group where we're really trying to encourage that, right? No judgment. Say what comes to mind. It's a space for learning. You want to really make sure that that's communicated to people who are going to be participating in the brainstorm session. You want to keep the group focused on the aim. You want to encourage out-of-the-box thinking. Maybe that means bringing some new people in. Decide if people state ideas, kind of just randomly, like if they're expected to speak up when they have an idea, or are we going around the room and soliciting ideas for each person one by one? Personally, I think that if you allow people to just naturally do it, it's definitely it's more helpful. But if you start to see that there's only one or two or three people who are constantly giving the ideas and you're not hearing from the rest of the group, solicit ideas from the rest of the group, right? Even call some of those people out and say, we haven't heard from you yet. Do you have any other ideas that you'd want to share? You'd want to start with a creative exercise to really warm up the brain. So that can look very, it can be very basic, like draw something, right? Draw a picture of where you want to go on vacation next, or draw, there's like little doodles, there's lots of things online that you can use. You can use something that maybe plays on music, but that really helps to kind of get this process going so people feel more comfortable, they're awake, they're willing to share, have coffee. That's always really important. Write down the idea and confirm that you've captured it correctly, right? Because we can interpret things differently depending on what our experience is or what our roles are at the agency. So always write down the idea, but make sure, is this what you meant? Am I capturing this correctly? You can do it verbatim, but you can also kind of shorthand it too. Quantity is the aim with brainstorming. You never ever want to communicate that anyone is the judge of quality. We're not here to assess whether an idea is viable or feasible. It's about let's generate more ideas. And in line with that, you also want to help try to encourage building on other people's ideas. So when you hear an idea and you're ready to share something, say yes and something else, right? Because we're building off of that idea. That's just part of the process of generating brainstorming ideas. You want to stop any crosstalk. If people are talking about other things, or if they're starting to kind of get in the weeds about why an idea is good or bad, or why something won't work, get the group focused, right? And make sure that you're encouraging that. We're here to just generate ideas. We're not here to judge or critique or figure out what the next step in the plan is. Just generate ideas right now. And I included a link that I'll share with the materials for today to learn more about brainstorming. There's hundreds on YouTube and elsewhere, but I thought this was a really great one because it kind of highlights what it looks like throughout the process, and it's not a scary thing at all. So if someone says, oh, I think we should try cutting down the form from 4 pages to 2 pages, let's say we're talking about an intake form, and someone responds, oh, we tried that already and it didn't work. What's wrong with that? What just happened?
You're shutting down
Just thinking-
conversation.
Yeah, you're shutting
shutting
down
it
the
down.
process, and people are less apt to share if someone is going to cut them down as soon as they propose an idea, because it's a brainstorm, it's ideas, it's not, yeah.
Absolutely. Yeah, I have nothing to add. That was perfectly stated. One thing to also consider is there's different tools to help remind people of when it's time to get creative and generate ideas, and when it's an appropriate time to maybe start assessing those ideas. So we call it green hat and black hat thinking. So the green hat is being creative, generating ideas, and you say, all right, we've got green hat on the table. You can even use a visual, something green. And say, while this is on the table, the only thing we're looking for today is ideas. We're looking to get creative. Let's build off of each other's ideas. Let's not judge anything. Let's not talk about what's risky or what won't work, right? That's for black hat. And we'll have some time designated to assess those ideas. So just something to think about. Use visual aids, use cues, use anything that might help the group stay focused and just focus on generating ideas. So we're taking it back to our case study. We want to brainstorm why patients don't access the needed mental health services. Because if you remember from our case study, we have 500 clients. No, I can't remember. I think it's 500 clients, but only 50 people were accessing mental health services. And we know that there's 45% of patients who probably would have benefited based on some kind of screening tool that we already have in place. So let's say we did the brainstorm session and this is what we came up with. Patients don't think they'll benefit. Case management staff don't have a regular referral pattern to any specific providers. And that happens a lot. You'd be very surprised. That happens across multiple providers, but as well as within the agency itself. There's no on-site mental health provider. That's already a huge barrier. There's a large mental health clinic across the street, but they have no evening hours and the staff don't routinely interact with theirs, so maybe there's no relationship. It's hard for patients to schedule an appointment, maybe because patients are working, and they're doing well in other areas of their life, but it's hard for them to take time off for an appointment. Patients have no funds for co-pays. That's also a huge barrier, but one that the Ryan Way program can obviously assist with in many cases, but not always. The mental health clinic is not on the bus line, and we're talking about the other mental health clinic, so that's not really accessible, from a travel perspective for people who lack transportation. You may also need a babysitter to keep your mental health appointments, and that's not something that's available to everyone, especially those with families, or let's say they're a caregiver. That's also important. Let's say there's also no reminder system from the mental health clinic for the patient of their initial visit or their time or even any of the follow-ups. So that's why it's difficult for clients to keep the appointments, is because they don't have any reminders. The case management doesn't know the details of the appointments and they're unable to remind the patient. So we know that this is very true, especially of mental health services, because of confidentiality. Many times that none of that information is shared, right? There's no case conferencing available. So look at this list and see if we find any items that are similar, right? Can we whittle down this list without losing the ideas, right? Because the idea is not to shut down any ideas that came through the brainstorming session, but maybe we want to consolidate if there's an opportunity. It might mean adding some words and then deleting one of the bullets, right, in order to make sure we've captured it appropriately. Are there any that jump out as being similar right now?
This is JT, by the way. I think if we stay with the no reminder system for mental health clinic for patients and we take off the last one, I guess both are related, are the same topic. So just keeping or combining them both of them and making one.
Yeah, that's a great suggestion.
Yeah.
So you could say something like, a reminder system is not available for patients and case managers don't have the details, right? And or there's no process for case managers to provide reminders to the patients.
Sounds
So,
good.
yeah, absolutely. And there may be other ways that we can consolidate, but it's not important. It's not necessary, right? We've already, let's say that there were 30 suggestions altogether and we've whittled it down to this list. This is all already really great to work with in terms of the number of ideas. Remember though, when you're doing the brainstorming session, you want to generate as many as possible before you start this process of trying to kind of consolidate or narrowing it down to the ones that are probably going to be the most impactful, which is part of our next discussion. So I want to kind of introduce something called the 5 whys, which is a lean technique. So this is a QI tool. If you're not familiar with lean, don't worry about it. It's just a type of tool that's used in quality improvement. It focuses on reducing waste, or muda, which is from like Japanese terms. So all it involves is repeatedly asking why, and it allows you to get to the bottom of something or the root that is causing the problem. So think about, I'm not sure if this is really the right age group. There's just kind of from the example that I was given. Think of a 4-year-old child driving you crazy, asking why for everything. But why? But why? Right? I don't have children of my own, but I imagine that a 4-year-old is probably in that stage where they're asking why about everything. And that can drive you crazy, right? But this is actually really helpful. It's important to encourage that, and I know that's something that as a parent, you're probably like, oh, enough already. When do we get out of this stage? But let's go back to that, right? Let's go back in order to assess what our root problem is when we're looking at something that we're trying to improve. It's always helpful to kind of consider that creative process that a child has, because they don't have a frame of reference for why things are the way they are, right? So they're just gathering the information. 5 is the rule of thumb, but sometimes you can't get to 5, and that's okay. But it's always encouraged to use 5 whys, get to 5 whys. So this is what it looks like. This is a very rudimentary example, but one that works really well, I think. So the problem is I ran through a red light. Why did that happen? Well, I was late for work. Well, why did that happen? Because I woke up late. Why did that happen? Because my alarm didn't work. Why? Because I exhausted the battery. And obviously, this is not looking at current technology with phones, but let's say your phone is your alarm and your battery died. And why did that happen? You forgot to check it right before you went to bed. You forgot to put it on a charger. There's a typo there. I apologize. So I forgot to check it, right? I forgot to check that the battery was charged or was on a charger. That's your root cause, right? We've gone through 5 whys and gotten to the bottom of it. So let's practice using our case study, right? We're going to choose a reason from the brainstorm list. So this is our brainstorm list. Let's pick one. What do you think is probably the most impactful or primary reason why our patients in this fictional example are not accessing the mental health services?
They don't think they'll benefit.
Big time.
Patients don't think they'll benefit. Ooh, you picked a good one. I think that's a hard one, actually. All right, I'm going to stop sharing this screen. Oops, let's go back. So this is what our 5 whys template's going to look like. So very similar to that example, but we're going to have a primary cause, right? And here is where we would identify the problem. And I guess I might have deleted that label, and I apologize. The problem is where you want to define at the top. And then you start to ask, why is this happening? Well, why is that? And then you fill in each box the more you go. If the final why has no controllable solution, meaning you can't do anything about it, and I really encourage you to take that with a grain of salt, right? Because there are a lot of things that with the right people at the table, you can generate a potential solution. But if you do happen to find a final why and there's absolutely nothing you can do about it, maybe funds are too restrictive, which, that's not the end all. Return to the previous why, because maybe that means that we've kind of gone too far too quickly and we need to kind of go back and reassess what the last why was and see if that needs to change. The last why becomes the root cause, okay? So the example, sorry, what was the example? Oh, patients will not, what was it again? Patients don't think they'll benefit from it. All right, so I'm going to close this out. Should still be seeing my screen here. I'll make it a little bit bigger for all of us. All right, so again, this is the template. Define the problem, what's happening, it's happening because, it's happening because, it's happening because. You don't have to use this language before you say everything, but you know, it's just the template. So let's get into our case study. Few clients who need mental health services are accessing these services. Do you agree with that problem statement? Would you change anything about it?
Well, if we wanted to get more specific and talk about an improvement, then we might want to identify the percentage of patients, the percentage of clients, so that we can know when there's an improvement, we've gone up, right?
That's a great point. Yeah. So you can get more specific here if you want to talk about what few means, right? But for the purposes of this discussion, let's say that we're all very familiar with, you know, what few means. We know exactly how many clients we're talking about, and then we'll just jump right into our primary cause, right? So let's say that our problem is few clients who need mental health services are accessing these services. It's happening because patients don't feel they will benefit from mental health services. So right away, we take the first brainstorm solution or brainstorm idea and we challenge that. We ask why. So why is that? Why do we think patients don't feel they'll benefit?
Because staff, no one is explaining to them the benefits of receiving mental health services. That could be one of the reasons.
Great. And why is that?
Staff might not really understand the benefit of the patients, of the clients receiving mental health services. All right, I'm gonna hush.
No, that's great. Staff may not understand the benefits of mental health services themselves. Feel free to chime in. Why is that?
And the patient's doesn't have that social support. So like the case manager can explain this to them, but it's just not enough. So their family or friends or whatever they're around is not helping to influence them to get that mental health, treatment. They're kind of like downing it. They're negative about it.
The staff or the patient?
The patient's environment, like their family and stuff.
Okay, so
I think she was on
maybe
step 2 with that.
Oh, sorry.
say again.
I think she was looking at step 2 for that.
Oh, no one is explaining to them the benefits of receiving mental health services?
No, and I think for 4, the staff staff may not understand the benefits of mental health services themselves. Why is that? Because staff is not appropriately trained
Boom.
on expressing the benefits.
Yeah.
So staff need additional training
Mhm.
Yeah.
on mental health services and the benefits they provide. And why is that?
Perhaps it could be funding set aside by the organization for training or something like that, something along those lines, or it could be a number of reasons, like
Right. It could
staff
also
is
be lack of
overwhelmed.
prioritizing.
Yeah, so I kind of reworded it here instead of saying staff need additional training, because we want to ask, well, why is that? We can say staff lack training on mental health services and the benefits they provide. And why is that? Maybe because of funding, maybe because of priorities, right? They have other priorities, or the agency itself has other priorities. Anything else? We're on our
just
last why, so it
lack-
could really be a lot. Go ahead.
Lack of identified trainings.
Lack of identified trainings, maybe lack of trainings identified. Maybe there are trainings, but you're lack a trainer. Lack trainer. And it could be because of funding. It could be because of priorities. It could be because of those same reasons. So let's just leave those all examples in there. You don't have to come up with that many for the last one, but it's important. I wanted to kind of include it because this was a really great example. So this is our root cause, right? Lack of trainings identified, lack of trainer or funding or priorities. And so if this is the root cause, then clearly we need to come up with a potential solution, right? And see if there's something that we can test, see if there's something that we can change, see if there's an area of improvement. For the purposes of this discussion, we won't go through the rest of the template right now, but what you can do is decide what your corrective action is. Sometimes that's very clear, sometimes it's not, depending on what you're looking at in the 5 whys. You'd also want to identify who's the responsible party, the date that you're going to begin, the date that you're set to complete. But again, this part is almost like you probably don't want to jump right into that right away. You want to really kind of sit on this root cause piece. So let's pick one of these as the root cause. What do we think is the more likely root cause of staff lacking training on mental health services and the benefits they provide?
I'm going to say, I think it's probably prioritizing.
How does the group feel? Do we agree?
I agree.
Okay. So how do we want to word this? It's hasn't been a priority for the organization. Do we agree with that? Would you change it?
So I would say it hasn't been identified as a priority.
Ah, I like that. It hasn't been identified as a priority.
I did realize, but because I'm a Looney, so I think everybody should be.
Because now we can do something about it, right? We can decide, you know what? This is something we need to look at. It should be a priority. Let's do something about it, right? Let's make it one. So that was great. Anything else you'd change about any one of these whys? I think this was an awesome example. So now I'm glad you picked that brainstorm idea, Jessica, because I thought it was going to be harder.
Yeah, me too.
But see,
After
some of
you
these
start
hardest
looking at it.
ones are a great one to challenge our understanding of these tools. So great job. I'm going to go ahead and minimize this for now. Just kind of keep this in your head. And let's go back to our, oh gosh, I'm on a Mac today and it's real confusing. Okay. So we've got our lean technique down. We understand how to use the template. Now, let's say that we have brainstormed our ideas for why the problem is what it is, and now we need to consider solutions. So let's let's say that we've already come up with some solutions. We've done another brainstorming session for solutions. Let's say that some of the ones we've come up with are to build a business relationship with a mental health clinic across town so data and information can be exchanged. This would be our primary referral site. You could hire a part-time psychologist to work in an office in our building. You can ask the mental health clinic to lend us part-time providers to sit in the office or come up with some kind of MOU agreement. So you can locate appointments, I don't think I meant to say that. So we can schedule appointments with a focus on after school or work hours, depending on the patient. You can work with the mental health clinic across the way to provide a safe place for the children of patients to wait while the parent is being seen. So that goes back to the idea of not having daycare. Providing transportation for patients to attend the mental health provider of their choice. You can incentivize patients with a gift card. Don't we wish, after they complete their mental health appointment? Create a brief infomercial to play in the exam rooms regarding mental health services and the benefits they provide. So that could be something that would be a potential solution to it hasn't been a priority. We don't think patients will benefit, or patients don't feel that they'll benefit from them. Maybe they just need more information, or there's an opportunity to provide that education directly to them while they wait, while they're in already, right, to see their provider. Provide direct reimbursement to the mental health provider, so there's no upfront cost to the patient or the reimbursement needed. There's an agreement between the clinics to share appointment dates and times so that we can make sure that we have appointments accessible to clients and we know when those appointments can occur. We can also hold regular case conferences to discuss referrals and no-shows, and that can be within the agency, but that can also be outside of the agency to have those case conferences. And you obviously have to have an agreement for that and only be talking about patients that you share, of course. So in terms of your 5 whys, the root cause that we identified was that it hasn't been identified as a priority. Mental health services have not been identified as a priority. What are some potential solutions you can use from this list or come up with one of your own for that root cause? So patients don't feel they'll benefit because ultimately it hasn't been made a priority at the organization, right? Or it hasn't been identified as one.
Well, so it hasn't been identified to train the staff, right?
Well,
So
it hasn't been identified as a priority for staff to train on or for the patients to receive any information, right? Because they don't understand the benefits either.
So then we would make it a priority?
Yeah, absolutely. And how do we do that? There was one
By the-
example from this list, but you can feel free to add a different one. Okay, no problem. I mean, let's say that for the purposes of this discussion, we decide, you know what, this idea to create a little infomercial or some kind of video that plays in the exam room, or let's say even the waiting room, right? That way you target a broader audience. You can play that in the exam or wait room regarding mental health services. And that way the patient is actively getting information, right, that may help them understand the benefits. It may help generate discussion or questions when they do meet with their case manager, with their provider, and say, hey, I just heard on this thing, you know, that getting mental health will help you maybe manage the stress in your life. Like I have a lot of stress in my life, or I didn't realize I may not be sleeping well because I'm stressed or I'm depressed or whatever that could look like, right? And now suddenly the patient is understanding more about the benefits, right? And they may have a need to, or not have a need, but you might be able to help them identify a need for mental health services or a potential referral that they might need. But this also helps because it gives the staff a chance to kind of circle back with the patient. And so it'd be really important that whatever's in this brief infomercial, staff are aware of what the message is, of what the content of that infomercial says. So they may need more training themselves, right? So that could be a dual solution that helps to really impact the client on both sides. What do we think about that? Do we hate the idea? Do we love the idea? Is that something you could see?
Yeah.
You like it? Okay. Is that something you could
Yeah.
see yourself implementing at your own agency? All right. So we are at time and I don't want to keep you all. I think I do have another few slides. So I kind of want to get a quick read from the group. Would you like to power through the remaining slides? So I'm on slide 48 of 55, or we can pick this back up next time. I do want to respect everybody's time.
I just have to be off by 11:30.
Okay.
I have an appointment at 11:15. It was supposed to be 11, but I
Okay.
thought we would go a little late, so I put it at 11:15.
We can
I
power
hear
through.
that. No, I hear that. That's good planning. I wish I did more of that. I actually also have an 11:30, so yeah, I just realized that once you said it. So we'll go ahead and end with, at this point today, and we'll pick this back up next time. But like I said, it's very short, the remaining part, and I'm still going to send the slides out with the full presentation so that at least you can have that to review before next week. Not next week, next month, excuse me. There might be a need to change the time or the day of this meeting. I want to make sure I'm respecting everybody's time and I do get everyone's availability, because there are some groups from other providers that would really like to participate, but this is just not an available time for them. Would we consider possibly keeping the same day and moving to another time, maybe in the afternoon, or what do we think for the folks on this group?
That works for us.
Yeah,
afternoon?
I'm fine if we could, as long as I can put it on my calendar ahead of time to block that time off, so I don't have any
Okay.
conflicting scheduling.
It's fine with us too as well. The timing and date, it's okay.
Yeah, as long as we can schedule ahead, we should be good.
Yeah, we should be good.
Okay. All right, so I'll look and see if Thursday afternoon, the same second Thursday, but in the afternoon is going to be best for us for the other folks who are also wanting to participate. And I'll send out a doodle, probably like a poll, to make sure that that's something that most people can participate in. But again, I mean, these are totally optional sessions. You're not required, but we're really happy with the participation so far. So I really want to thank everyone for being consistent and joining. And so I won't require any homework before next month because I think it was important to get through the whole presentation. And since we didn't, you know, you're welcome to take a stab at it, at least for developing an aim statement, since that's something that we did have a chance to get through. And, you know, it doesn't have to be a final draft. It can be just your first idea. But if you want to take a stab at that before the next month, I'll send out a reminder. So try that. We'll provide a template for you to be able to do that. And then if you do have just even a minute to do our mentee evaluation, you can just scan the QR code that's on the screen or go to mentee.com and then you can enter that code, and I'll leave that up for everybody as we kind of wrap up for today. But thank you so much again. It really does help to have that feedback and to know how this is going. We've been getting some really positive scores and responses so far, so we definitely look at all of the information. But you all did very, very excellent today, and I was really happy with the charts, especially our review of the homework. That was awesome.
All righty, thank you.
Thank you. I'll stick around for any questions or final thoughts, but if not, I hope you all have a great rest of your week and an excellent weekend, and we'll see you next month.
Great, thanks.
All righty, bye-bye.
Thank you.
Thanks.
All right, bye-bye.
Bye.